Eric O'Flynn. I'm the Programme Director for Education, Training and Advocacy in the Institute of Global Surgery in RCSI. Well, we know that the lack of a trained anaesthesia workforce is a major contributor to the lack of access to surgical care in East Central Southern Africa. And indeed, when patients do receive care, it's a major contributor to relatively poor outcomes of surgery. So RCSI has been working with the College of Anesthesiologists of Ireland and the College of Surgeons of East Central Southern Africa to support anesthesiology training through the College of Anesthesiologists of East Central Southern Africa. We wanted to create a detailed baseline analysis of the workforce to devise strategies for training and indeed retention of the anesthesiology workforce in the region. I want to acknowledge as well Queens University Belfast and the Association of Anesthesiologists of Uganda, who were key partners in the study, which was funded by Irish Aid. Well, the World Federation of Societies of Anesthesiologists and others have recommended a minimum of 4 or 5 anesthesiologists per 100,000 population. And we know from a 2017 study conducted by the World Federation of Societies of Anesthesiologists that there was only 0.17 anesthesiologists per 100,000 population. We wanted to see if that figure had changed and more importantly to understand more deeply the characteristics of the workforce, their demographics, age, sex, exact location, where they received their qualifications and further details like that. Well, there remain very few anesthesiologists in the region, although numbers have increased slightly. The ratio is now 0.19 anesthesiologists per 100,000 people. Although there's been an increase in anesthesiologists, nearly half of that increase has been accounted for by population growth. So therefore the ratio hasn't moved significantly. There's a big difference between countries. The difference between the country with the highest ratio, which is Zimbabwe, and that country with the lowest, Malawi, is nearly 20 times. To put it another way, Malawi has approximately 1 anesthesiologist for every 5 million people. It's a relatively young workforce and growing, which bodes well for the future. And in terms of gender, it's about 2/3 male and 1/3 female. However, among younger cohorts, it's getting closer and closer to a 50-50 male-female split, which again bodes well for the future, given that undergraduate medicine is increasingly female across the region. Well, the anesthesiology workforce needs to grow in the region, and new pathways are required to deliver that workforce at the scale that is required. College of Anesthesiologists of East Central Southern Africa are opening up new avenues to rapidly increase the numbers of anesthesiologists trained in the region. I'd like to particularly acknowledge the lead author on this, Judith Asengai. This study was published accompanied by an editorial in the journal Anesthesia and Analgesia, and I'd like to thank Prof. Wayne Morris and Prof. Angela Enright for that editorial. And finally, the information published in the study is also available in the form of an interactive map on the CANEXA website, and for that I'd like to thank Hayley Sledge.